Meeting for City Commissions called to order. Clerk, call the roll.
Mrs. Brown? Dr. Estrop?
Here.
Mrs. Houston? Here. Mrs. Tackett? Here. Mr. Riff?
Here. City Manager.
Yes. Commission, tonight we have one work session item before you, and that is a presentation on the community health assessment. And with us tonight from the Health Department is Anna Jean Sauter and Gracie Hemphill. Welcome.
All right, well, thank you. Thank you for having us. I'm Anna Jean Sauter. I am the Community Health Accreditation and Data Coordinator at the Health Department. And with me tonight is Gracie Hemphill. She's our Deputy Health Commissioner. And we would like to share a little bit about this year's Community Health Assessment, which was just released at the end of July. But before I dive into our community health priorities, I want to give a little bit of a background about what a community health assessment is. We do these every 3 years at the health department. Every health department in the state of Ohio does it. It is kind of dictated to us by the Ohio Revised Code. The hospitals also have their version of the same thing. Theirs is through the IRS, but we work together to make sure that our plans are aligned. And it essentially, we use data to paint a picture of health in the community. And through that data, we identify key health needs. And then we use those needs to write the Community Health Improvement Plan, which is kind of the roadmap for the next 3 years to try and improve some of the targeted health outcomes. In the Community Health Assessment, like I said, it's all data. There's a lot of data. But the first step is to gather some partners around the table. And we really are careful about who we include. We want to make sure we have representation from all areas of the community. It's important to mention that this is not just a health department thing. It's very much a community thing. We have a large group in our steering committee that helps guide data collection decisions and helps to review data and identify those health priorities, and also helps to build the Community Health Improvement Plan when that time comes. Then we gather the numbers, the hard data, and that's that status update. What's going on? What does the data actually tell us? And then we have a few different assessments that get at the context of the data. So why are these conditions happening? And then as a steering committee, we get together and we review all of the data together and try and decide what has risen to the top as the health priorities. And these are some of the questions that we asked ourselves as a group. What is the level of impact on from this health, whatever health outcome? What would the return on investment be if we decided to target this for the next 3 years? How urgent is the issue? Is there any funding available? You know, even if we put this in the Community Health Improvement Plan, is there any funding that we could use to move the needle? And then also, how feasible is it to implement some of the ideas that we have? Is there existing momentum in the community already, or maybe momentum that we feel we could renew? And then finally, arguably the most important, is this supported in the data? So we got together with our steering committee, and these are the issues that kind of rose to the top for health priorities: chronic disease, mental health, maternal and infant health, and community stability. And then we also identified cross-cutting factors. At the bottom, you'll see those written across the bottom. And those are just factors that are important, and they have pieces in each one of the community health priorities. So transportation, access to care, trauma, and socioeconomic instability all show up in those 4 pillars that you see on the snapshot. It's important to also mention that this is just a snapshot, right? The community health assessment is large. there's a lot of data in it. And these are just the pieces that kind of the steering committee decided rose to the top and emerged as health priorities. That said, I can tell you kind of what I see as the most the biggest part of these health priorities is that youth health, youth well-being kind of pops up in all four of the categories. So I'm kind of going to start in the middle with maternal and infant health and point out that children in Clark County are more disadvantaged from the outset. 23% of mothers in Clark County receive inadequate prenatal care, and that has nothing to do with the provider that they're seeing. It's has to do with the time at which they enter their prenatal care, like how far along they are, and then also how many times they go to their prenatal care appointment before baby actually comes. That's how that inadequacy is measured. So 23% of moms in Clark County have inadequate prenatal care. And that kind of trickles out into the birth outcomes for Clark County with infant mortality and low birth weight and preterm birth. The birth outcomes here in Clark County are worse off than in Ohio. You can also see that there's a racial disparity in our birth outcomes, with Black babies and Black mothers experiencing worse health outcomes than white babies and white mothers. Youth mental health is another area of concern, moving towards to the mental health pillar. 42% of high schoolers in Clark County report that they don't have a trusting, a caring adult, a relationship with a caring adult in their lives that they feel they can talk to about their feelings. And 36% of high schoolers reported feeling sad or hopeless for 2 weeks or more in a row in a single year. Moving to our community stability pillar on the complete right. This is homelessness in Springfield, specifically youth homelessness, is significantly higher in the city of Springfield than it is for the rest of the county and the state. 6.2% of youth in Springfield City are experiencing homelessness as compared to 1.8 in our county and 1.5 in the state. Moving to the chronic disease pillar, our child food insecurity rates are higher in Clark County compared to Ohio and the US. 23% of children are food insecure here in Clark County, compared to 19.8% Ohio and 18.5% in the US. And it's poor social determinants of health like these, like the food insecurity and the homelessness, that impact physical and mental well-being and overall health outcomes. And that trickles up. I don't know if that's the right phrase because trickling up, but you can see that in our leading causes of death in the top left corner of that snapshot. And you can see 5 out of the top 6 leading causes of death are chronic diseases. So it's important to address these so that we can try and enhance health and lead to better health outcomes for all, starting with our young residents. Now that we've identified these health priorities, we are looking for feedback.
Yes, and as Anna Jean mentioned at the beginning of her presentation, this isn't a health department assessment. This is really a Clark County community health assessment. So we are looking for feedback from the community, not just the partners around the table that come to meetings, but anyone that would like to provide feedback. So we're doing that in 2 different ways this year. We are hosting 2 virtual community conversations where people can register to get a link to a Teams meeting and hear this presentation from Anna Jean, dive into the data a little bit deeper, but then also we turn it over to people online and say, okay, are we missing something? Do these resonate with you? How do you feel do we miss a mark? And really have a conversation around that. So you can see there, we're having one tomorrow from 5:30 to 6. So the registration is on the health department's website, so you can just go there. And the whole community health assessment document is also linked out on our website. And then we're having one at the end of the month from 12 to 12:30. But if people are unable to come to the virtual meetings, we also have an online survey that pretty much asks those questions. Links to the community health assessment, shows the snapshot of the priorities, and you can make your feedback known. A link to that survey is also on the health department website.
And I think the last thing that I want to mention is that our next steps after we gather this feedback, we'll get back together with the steering committee and start to think about strategies and activities that we can implement in our community in that community health improvement plan for the next 3 years. So this will help inform that plan. And I think that's all we have for you tonight. So welcome any questions.
Commissioners? Dr. Esprow?
First of all, thank you for sharing this information with us. We sincerely appreciate it. It helps inform decisions we will make also. And one of the things I notice at the bottom across the bottom cross-cutting factors is transportation. I hope that you're in touch with Jason Villa of our staff so that you understand the new public transportation system we have, because I think that should help address that issue in some fashion. So I hope it does. That was one of the motivations behind changing from the fixed route system to this micro transportation system.
Yes, it definitely will be involved in the next stage with the community health improvement plan when we look at strategies. And also through that process, we look at our community asset and what can be used towards those strategies. So that will, the new transportation system will definitely be a key part of that.
Good, super. The other thing I wanted to raise a question about looking at the chronic diseases. It would appear to me, and I'm uninformed in this regard, but a number of these are related to smoking. It would appear to me are related to smoke. And I know we've worked with you to try to push some legislation locally that in fact address this among young people. And the state overruled us. I think that has now been rectified. But is that your conclusion also, that many of these chronic diseases are related to use of substance, including tobacco?
I think that that's definitely one of the contributing factors. I think we are also looking at physical activity and healthy eating. So healthy eating, active lifestyle.
Okay. Thank you so much.
Thank you so much for being here. Having just had a baby recently, the maternal and infant health statistics really jumped out at me, especially almost 1 in 4 women not receiving adequate prenatal care. I know, how important it is with all those screenings and everything. I thought it was very interesting how you did link that to the rest of, almost trickling up to the rest of the issues that we're facing as a community. One other thing, and you kind of just touched on it, Dr. E, with the chronic diseases, how much of that do you think is related to not having enough grocery stores and somewhat food deserts in certain parts of the city?
We definitely, the community health assessment definitely highlighted that issue. You can see that in our food insecurity statistics, that food insecurity in Clark County is higher than it is in Ohio and the US. So that means that it's harder for our people to get to the grocery stores, or maybe the grocery stores with fresh, healthy foods are not accessible to them. There was one more, it just escaped me. Food. mom brain. I'm not too young for it. Yeah. No, there was something else that you can add.
Regardless, I hope,
Yeah.
we can continue to, prioritize having healthy foods and maybe even more grocery stores in the city. But thank you for everything tonight.
I just wanted to share, thank you for the work that you have done on this. As you know, I was around the table for multiple meetings with you, and it was just very impactful seeing this information brought to the community. And as I shared with you, I think that it is crucial that leadership and decision makers within our city, our community, and our county receive this information as a tool as they're making decisions, as a lot of it crosses with others. The youth homelessness was just one thing that really stood out to me. And then connecting all those pieces, I really advocate for prevention a lot. And that's across the board in many different ways. And this is a tool that people can use, again, as they're making the decisions, and especially around prevention. So thank you.
And so the two dates that we need to make sure the community knows is September 10th, September 30th. Your input is valuable. And so those are at 5:30 to 6 and 12 to 12:30. So thanks for being here. We appreciate the information you've shared
you for
with
having
us.
us.
Look forward to the balance of work. Thank you. Yeah, is there a motion to adjourn the work session?
So moved.
Second.
Been moved and seconded. Clerk, call the roll.
Dr. Estrop,
Yes.
Mrs. Houston,
Yes.
Mrs. Tackett,
Yes.
Mr. Rue.
Yes. Dr. Estrop, have the